Low level of living, Indian perspective. Coming to the last characteristic of Indian economy, that is, low level of living. As we have seen, there are various parameters on which standard of living depends. There are various factors which indicate a low level of living for the Indian economy. They are low calorie intake or malnutrition, lack of safe drinking water, poor housing, high infant mortality, high illiteracy, poor educational facility, poor medical and health facilities. Let us understand this concept with an example. Shyam, a farmer, is earning an income of Rs 1000 per month. He needs to support 3 more members of his family, namely his wife and 2 children. With an income of near Rs 33 per day, he needs to sustain 4 individuals. It goes without saying that the highest priority under normal circumstances he would give is that to food. That his family would be able to intake a nutritious, balanced diet is certainly out of question at this moment. Thus, low calorie intake is one of the major indicators of low level of living. Similarly, other factors such as safe drinking water, housing, basic medical and health facilities, education would be considered by Shyam only if he is able to arrange for 2 proper meals a day for his family. A quick look at various statistics. Low calorie intake or malnutrition. Lack of safe drinking water. Those deprived of safe drinking water become victims of all types of waterborne diseases and also partly responsible for the low level of efficiency of the Indian workers. According to the census of 2001, only 16% of the household in India had no access to safe drinking water. Poor housing. According to the census of 2001, only 52% of the households were living in permanent houses, 30% were living in semi-permanent houses, and 18% were living in temporary houses. High infant mortality. Infant mortality rate in India in 1990-91 was as high as 123 per thousand of live births, which dropped to 93 in 2001-2002. High illiteracy. In 2001, the literacy rate in general was 65.4%, with 75.8% for men and 54.1% for women. Poor educational facilities. To carry forward the movement of higher development, investment in human resources by way of quality education is a must for India. Poor medical and health facilities. There has been a considerable improvement in the availability of medical facilities and public health services. To summarize, people living in low-income countries have, on average, a lower level of real per capita income. Low income leads to low investment in education and health, as well as plant and equipment and infrastructure, which in turn leads to low productivity and economic stagnation.